This is Crystal Fenn with MedPage Today here in Paris at the EuroPCR meeting, where researchers have reported on a novel drug-eluting stent made with a bioabsorbable metal scaffold. Dr. Michael Haught reported the results at a press conference here.
The scaffold has an absorbable magnesium alloy backbone, which is covered by an absorbable polymer of 1 micrometer thickness that elutes paclitaxel. This new device, the scaffold, was implanted in 46 patients with de novo coronary artery stenosis.
The first-in-man study suggested improvements compared with the prior bare metal version of the absorbable scaffold.
Target lesion failure in 22 patients of cohort 1, the rate was 9.1%. There was no death, no myocardial infarction, no scaffold thrombosis, but 2 cases of clinically driven target lesion revascularization contributing to the target lesion failure of 9.1%. If we look at the 6-month angiographic results based on the in-scaffold analysis, the MLD was 1.88, the late lumen loss 0.68, and the binary restenosis rate was 10% to patients. In a rough conclusion of this data, Cohort 1 of the BioSolve-1 DREAMS First-in-Man study demonstrates 100% device and procedural success, an excellent, so far excellent safety profile without death, MI, or scaffold thrombosis up to 6 months. And we were able to show a significantly improved efficacy profile in comparison to the bare first-generation AMS, absorbable metal scaffold, which had an elution of an anticoagulative drug, with a reduction of late lumen loss from 1.08 to 0.68 millimeter, which is a reduction of 37%, and a reduction in the TLR rate from 23.8% to 9.1%, which is a reduction in the clinical endpoint of 62%. I think we are on a good way. Maybe we are not at the end of the day, but I think we clearly improved this device, going from a bare device now to a drug-eluting device, showing that the efficacy, especially the efficacy, was significantly improved. So far, with all of these devices being implanted, there was never been a safety issue. But the efficacy profile with the first generation was not as it was desired. So actually, I think this is a clear-cut improvement, and we are totally happy about that.
Haught suggested that the entirely bioabsorbable stent could be a good option for younger patients and those with earlier stage coronary artery disease. In Paris at the EuroPCR meeting, I'm Crystal Fenn, MedPage Today.